This is Mike Ricciuto with Physical Therapy Now.
I'm Reggie Delaney, owner of Panthro Fitness.
And we have the ability, which is great, to work together for comprehensive fitness down on Penn Avenue. And there's a lot of things that we both see about this time of the year that the reason we're doing this video is to inform folks about running. And we both see runners all the time. And running's an interesting sport because anybody can do it, but there are so many ways of getting injured that people aren't aware about until it happens.
Absolutely. And it's something that I see, like Mike said, I see oftentimes within the gym. And I'm not against running by any means. I want you to make sure that you understand that that's clear. What I am against is running irresponsibly, shall we say, and not doing the proper things. If you're going to be putting a lot of running miles on your body, expect your body to break down if you don't take the proper precautions. And we're going to talk about in order to keep the machine moved and running properly.
Exactly. Now's the time of the year for the Pittsburgh Marathon. It's always a time where, I know Reggie says the same kind of thing, we get a frantic call every year about this time saying, my ankle kills me, my knee hurts, I'm supposed to be running 26.2 this Sunday, and I don't know if I can do it. And it's too late at that point. So we want to prevent that. And talking about the things that will keep you away from that, or at least give you a little bit of insight. I guess we could start off with talking about the common injuries that we see. And the first one that we always tend to see with runners, tight hamstrings, doing a lot of things to the hamstrings to strain them, to make them painful. A lot of runners have tight hamstrings. The flexibility issues come into play. A tight hamstring can happen from many different reasons. Could be a shift in your pelvis, could be low back pain. Most of the time it's from inflexibility from not stretching. And tell me a little bit about what you see in the clinic, your place.
What I see, and when we do our evaluation, and I can tell right away when I have a runner on my hands, a distance runner, because the strides are very short and they're usually not their proper gait. So they're not really getting the full extension, which is causing, like, imagine if I did curls like this constantly for about an hour. All right, so that's what you're doing when you're running on a stride that's too short. And so you're strengthening a tiny part of the muscle, and then all of a sudden things are pulling in the wrong places, and your hip flexors are tight, your hamstrings are tight, your glutes don't seem to fire, and it's because you've been working in that limited range of motion for so long repetitively. So one of the first things I like to work are some range of motion ideas, and we're going to talk about some things that's going to help you to get that range of motion.
Definitely. Reggie, hitting on some of those big points, limited range of motion in firing those muscles of the hamstrings in a certain range where it inhibits other motion of other muscles that need to work. So that flexibility component's big. The hamstrings, tight hip flexors, Reggie mentioned, and that will decrease your range of motion of the joint. The joint has a certain mobility range. It'll decrease that. That leads to injury because now you're forcing energy, into places that only have a limited range of motion, and that ends up giving you problems. That's big. So having the flexibility is gigantic. Lack of strength. We talked about, okay, if you're working your hamstrings repetitively over and over and over, you're going to have some pretty darn strong hamstrings. But what about the rest of the muscles? We're a big chain. We're not just certain muscle groups that work together. It works as a chain. If you have weak hamstrings, if you have weak hip flexors, any number along the chain, you can get injured when you go to make a movement that involves the strength of those other muscle groups. I always harp about the pelvis being weak in runners, the abdominal region being very weak in runners. Runners typically tend to have really strong hamstrings, really strong calves. Why? Because they're constantly going forward, constantly moving forward. but the other parts of the body are vital. They have to be strong. You make lots of lateral movements. You make turns. You even do some backwards walking sometimes. These muscles have to be strong. Once again, or some muscles will try and take over, and it'll cause strain and sprains and that kind of stuff. So, tell me a little bit about, Reggie. Tell me a little bit about what you see when they come in and you're trying to train these folks and what they want to do and what they should be doing.
Right. A lot of what I see is like to Mike's point with the straight line movement, struggles with lateral movement, okay, and change in direction. Because most of the change in direction occurs first in the core. Okay, you have to stabilize with the core first before you change direction. So it starts to become a little troublesome in catching your balance if you're not used to changing directions and you haven't strengthened the muscles properly in order to change directions. So that's what you have. Is a lot of times I see people that are doing even lunges, which is still a straight line movement, but there's balance involved. There's core engagement involved. It's a range of motion type movement. So I see that almost immediately with a lot of runners. And definitely with the change in direction and the lateral movement, it's usually slower. It's much slower than it should be.
Right.
So that's something that we immediately work on, is making sure that you're being athletic. Not just being a runner, just being athletic and being able to do whatever is required of your body to do. Your body doesn't move in space in just one direction forward. So it's important that we make sure that you're able to do multiple things with your body.
It's interesting when you have runners that are more experienced. They know what's going to get them into trouble. They know what's going to happen to them. Less experienced runners have this plan that they're going to go out and everyday run, and they're going to run straight, and they're going to do their thing. And really, to be honest with you, your short runs and your long runs, 2 times a week, maybe 3. The rest of it is training the rest of the body so that you're not running. And a lot of people get caught up in not knowing how to train. And Reggie sees this all the time, where they come in with a completely obscure type of training program to be running, the Pittsburgh Marathon or any other marathon.
Absolutely. And I like to look at it like running's just like any other sport. Okay, there is a certain amount of running you have to do to be a better runner. Just like if I'm a professional basketball player, I'm going to play a lot of basketball, but I'm also going to work on my jumping ability. I'm also going to work on my agility. I'm also going to work on being physical and building strength. So there's all these components that make a great basketball player. Just like there's a lot of components that you have to build outside of the arena of running that are going to make you a great runner.
Right.
Or more efficient runner, I should say. I'm not saying that you're trying to win the marathon. You want to compete in it and come out of it and feel good, uninjured.
You want longevity. Remember, we have one body, right? So there are internal structures that once you damage them, they don't just repair themselves. So we want to preserve, because I want to be in this lifetime as much as possible and have the right joints and go forward, right? We all want to be, being able to walk and do whatever we can. Reggie, why don't you show us some of the movements that that we were talking about as for a runner that people don't even think about. They don't think about lateral movements. They don't think about explosiveness. They don't think about putting your limb through the whole range of motion, of joint motion, to then accelerate their progress in what they're doing.
Absolutely. So what I have here, I have just a couple things set up. I can show you a lot more, but just for the sake of this video, I'm going to show you a couple things. Okay. First thing is something that you can get at home, and they don't have to be actual hurdles. All they need to be is an obstacle that you can get over. And the object of this, I'm going to show you a lateral high knee hurdle, and I'll show you just a regular forward high knee hurdle. The object of this for the lateral is, 1, to get you moving laterally, obviously. 2 is to get those knees up and get some full range of motion that you typically don't get when you're running. So all it is just moving, getting those knees up. It's like that. And you see how my knees come up in here. typically when you're running and you're kind of pacing yourself on a run, I'd be surprised if you get any more than this. You know, so you want to be able to get those knees up and get those hip flexors activated. Now, if you want to go forward, same thing. Getting those knees up, okay? Activate those hip flexors. Activate some of the other muscles that you aren't using in your distance runs. Another thing I have set up here is a band. It's a TFT band. And it's just linked to some rails over here, nothing special. But this is something, again, to get you that full range of motion. So you start back and you drive. So I'm really driving through. Another one that I can show you just to create some explosiveness. Okay, so I get tension on this band. I come out, boom, I fire through. I'm making my glutes fire. It's almost like I'm about to jump, but I never leave the ground. I'm doing the same type of motion. I'm exploding, using the glutes to explode through the band because it's providing some tension.
Excellent. And once again, like Reggie was saying, these are just a few techniques I know used here at our facility here, but they're, depending on who you are, what type of training level you're at, there's a wide range of things that need to be, you know, you have people who are just beginners at things and then experts. So we work with triathletes, but then we'll work with someone who hasn't stepped foot into a sport or just wants to enjoy a walk. So it depends on who you are and what level you're at. But you know, we have so much information on our websites. This is just, you know, we had to get this video out, and there will be more instructional videos too. But we certainly wanted to address a lot of the questions we get every single day. And if you have a question for us, absolutely, you can go to physicaltherapynow@gmail.com. That's my email.
Or you can go to train@pantherofitness.com or fill out a form on pantherofitness.com.
And we'll hope to see you soon. Thanks.